Greetings from down under. We want to welcome you to our virtual presentation. Australian sexual health practitioners identify new practitioner needed knowledge, skills, and comfort. My name is George Turner, and I'm joined by my colleagues, Dr. Robyn North and Dr. Gabrielle Drake. We are social work academics at Western Sydney University in the School of Social Sciences. While the pandemic has not opened our borders, we are delighted to have the opportunity to join this community of sexuality scholars and be a part of the 2021 Quad S conference in Puerto Rico. I'd like to begin by acknowledging the traditional custodians of the land on which we are presenting from today. All Western Sydney University campuses stand on the stolen lands of the Darug, Tharawal, Cabral, and Wiradjuri peoples. They are the original and ongoing owners, and I'd like to acknowledge that sovereignty was never ceded on these lands. We have no conflict of interest. This project grew from my interest to know and identify the sexual health landscape of Sydney. Next, Robyn will discuss our methods, and then Gabrielle will share our results. Robyn, over to you.
Thank you, George. I'll just start with some background information. So field education is the signature pedagogy of social work education, and it is now more important than ever in Australia to explore alternative placement settings due to pressures faced by universities in response to increasing student numbers, enrolments. Despite widespread agreement that sexuality is central to human identity and holistic well-being, a review of the literature reveals a vacuum in scholarship around field education and sexual health practicum placements. Alongside of this, there is also acknowledgement of the uneasy fit between sexual health and well-being and social work education and practice. Neither the North American Council on Social Work Education nor the Australian Association of Social Workers require accredited social work programs to provide comprehensive sexuality education. Perhaps not unsurprisingly then, there are limited studies that identify core sexual wellness competencies that are needed for entry-level social workers in sexual health practice settings. Therefore, the aim of the pilot study was to map sexual health and wellbeing services in key areas of social work practice in Greater Western Sydney, which has an approximate population of 6 million people. We also wanted to understand the types of services social workers provide in these settings and to discover new field placement opportunities for our social work students. Thanks, George. Next slide. As alluded to, the purpose of the mixed method study was to identify field education models and opportunities in sexual health and wellbeing settings, and to examine the sexual health and wellbeing content of Western Sydney University's master's and undergraduate social work degrees. Following approval from Western's Ethics Committee, 50 online surveys were distributed to staff of sexual health and wellbeing services to obtain their views on opportunities for social work students to undertake field placements in these settings. The survey instrument also included an invitation to participate in follow-up focus groups. As a result, 2 focus groups were conducted via Zoom for participants wishing to be involved in further discussions. Both focus groups were facilitated by George, with Gabrielle and myself each attending one focus group to co-facilitate. The focus groups were audio recorded and later transcribed and then thematically analysed. I'll hand over now to Gabrielle to discuss the findings of the surveys and focus groups. Thanks, Gabrielle, and next slide, George.
Thanks, Robyn, and thank you for the opportunity to present some of our key findings to you all. The social workers who participated in our study told us that sexual health largely continues to be stigmatised, medicalised and pathologised within practice. And further, that practice is often framed by Western, able-bodied and heteronormative understandings of sexuality and sexual wellness. They told us that social workers tend to work in organisations focused on sexual violence, fertility and dysfunction, and certainly not pleasure. They also emphasise the need for a holistic focus, moving beyond risk and deficit to sexual justice, and that this was indeed a catalyst for social workers entering this field. Two other key findings that I wanted to present today from the study focused on the need to adequately prepare social workers to work in the areas of sexual wellness and justice, specifically the need for a sexual wellness framework in the social work curricula. And I want to outline some of the specific areas here. Next slide, please, George. So what do social work students and future practitioners need from their curriculum? Social work curriculum needs to prepare students to be askable sexual health practitioners, to be knowledgeable of sexual wellness and community resources, reflective and aware of their own sexuality values, their belief systems, and their biases. The importance of being able to take a client's sexuality history, and for this to be holistic and certainly not deficit and risk focused. Next slide, please, George. And finally, the curriculum needs to prepare students to be sex positive advocates, to support clients navigate permission giving or consent, to engage in normalising of sexuality, and to be skilled in sexual trauma, violence, sexual exploitation, sexual abuse, sexual harassment, and sexual assault. Over to you, George.
In conclusion, social work education is a discipline that aims to help prepare students to enter the workforce as practitioners. Sexual health is a viable and legitimate field of practice, which most social work programs do not address. Social work educators must adapt their teaching content to ensure students meet the needs of the current workforce. This research examined the growing need for a sexually informed practice lens. This concludes our presentation. We want to thank you. Here is our contact information. Feel free to email us at any time if you have questions. We look forward to speaking with you. Thank you again so much for joining us. Take care.